Wellness Wednesday with Dr. Bradley Meyer, the Okoboji Wellness Clinic. Dr. Bradley Meyer, happy pre-Thanksgiving.
Happy pre-Thanksgiving, Dave. Happy pre-Thanksgiving to everybody listening this morning. Lots to be grateful for.
Yeah, a day away. So let me ask you this. What's your favorite Thanksgiving tradition?
Well, our family, last year we were actually out in Colorado, and it's doing a little kickball. We call it, it's like the turkeys versus the mashed potatoes. So, when it's not snowing, you put on the winter gear and get out there and stretch the legs. That's a fun one for us.
That's awesome. All right. We are right upon Thanksgiving. We have much to be grateful for.
Oh, it's a good time to reflect, for sure. You know, we at the Okoboji Wellness Clinic, we've been on quite a few journeys with a lot of individuals, and we've been here 3 years now. Marilyn Strickland helped us find this place, this building, and made this a reality. And as we've evolved over the course of the last 3 years, it's a good chance to reflect, and give a lot of gratitude and thanks for the opportunities we've had in Northwest Iowa, Southwest Minnesota to kind of bring forward more into the genre of there's something else out there with regard to health and wellness and quality of life. So, very, very thankful for, you and I were talking before we started on air a little bit about the last 4 to 5 years and some of the silver linings having gone through COVID. A lot of families were really impacted during COVID, and
tore a lot of.
I get choked up talking about it.
I know, because it tore a lot of families apart. Tore a lot of people apart.
But I focus on the positive, and I'm looking at, like, this year we're going down to my wife's family, and we had, a differing of opinion on how to approach COVID and such, and there's been a lot of reconciliation and coming together, and trying to find common ground, and so I'm thankful for that. That went through some of that hard to identify some areas of, always there's potential for personal growth, and then growth from how am I going to work in the field of medicine, the genre of medicine, to be able to do a better job than I feel like I had done in prior years, just being able to offer more. So very grateful. So I ask everybody just to reflect on that and try to stay in the positive of, like, okay, my mother-in-law that since passed, she always talked about love multiplies. And so,
yeah,
impactful.
Yeah, it is. You share with us a lot of success stories. The one that a couple of them actually, that I just can't seemingly get over, I find so remarkable, is your gal that was in the Council Bluffs area actually doing a FaceTime with you in the hospital. And then came up for, I believe it was a week stay with you, came in a wheelchair or a walker, and was just a few days, and she was up and around walking in and out for her treatments. It's a remarkable story. She had I got to give that young lady the most major kudos that she kept her attitude good, because her quality of life was down to not much. And boy, what a battler, and now she's got her quality of life back.
Absolutely. So again, it's wonderful reflect on those things and those stories, because that's possible. If you put it in your mind that I'm going to find an answer, and I want to work with some folks that are going to help find an answer. Just like I did, I got back, keep going into to the gym, and after we talked last week, I started to reflect a little bit more about it and how it is a bit. When you go in there, I did not play football in high school. I played baseball, a little bit of basketball, but I was not a gym rat. Mm-hmm. So for me, getting near a set of weights or kettlebells is that's a little intimidating, a little scary, and so I just showed up, and I'm 3 treatments in, three sessions in, and I think that's sometimes what folks have to overcome too when they're thinking about their health journey. And many times, again, when you're talking physical fitness, but coming in to see a doctor or an integrative wellness clinic, anything that's a little bit different, if we're talking about things like ozone, neurofeedback, hyperbarics, kind of a different approach, what's that all about? It can be a little intimidating. And so I want to encourage folks, like I did last week, just to say, it's worth stepping into that, mm-hmm. into that area of discomfort or uncomfortability, and that's where a lot of the growth happens, physically and spiritually, emotionally, as you walk into the wellness. So, but to acknowledge that's a big first step when folks come into the clinic. A lot of times, I just am congratulating them for taking that step into this space, because it's an unknown,
right?
And so they deserve to be congratulated. To just like you said with the gal coming up from Council Bluffs, that was a big step to where you feel so horrible physically to say, I'm going to go into this completely foreign setting and trust that this is the right thing to do. Mm-hmm. But and she did, and so many other countless folks have done that. It is worth it in the end. So kudos to those that do that.
Right, and one of the things that I think is that we're so fortunate is we now have the ability to do a lot of research on our own. For example, hyperbarics, and I just played about a 4 or 5 minute clip a couple days ago of Callie Means talking to Joe Rogan about the Flexner report and how the Flexner report basically said you either cut it out or fix it with a pill. There's no other options. Anything else is pseudoscience. And yet our very own government was using hyperbarics for injured soldiers that were close to bomb blasts. We know National Football League teams use hyperbarics. We've seen the success like crazy. There's not much pseudoscience about it. The research is there.
The research is there. And look at in whatever condition it is, whatever disease that, quote unquote, that we may have gotten a label for, look into it, because there's a Dr. Makis, Makis. He's an oncologist out of Canada. Great story, and he was on a podcast with James Templeton, who's got a stage 4 cancer, mm-hmm. and has had it for 30 years. And so fascinating to hear Dr. Makis talk about his story up in Canada over the last 20 or so years, and then bring it into the COVID era and such. And this is a traditionally trained guy at the top, one of the top medical schools in Canada, bringing some interesting perspective onto what is the best approach that we need to take for managing folks' health care, mm-hmm. their wellness care. And he's very honest about it, and throws he gets into ivermectin mebendazole, fenbendazole, and how those ones in particular will work to augment the P53 gene, which is, you want that because that's reduces all these cancer cell replications, as well as working to reduce sugar uptake in these cancer cells. So he gets into the science of it, and then he gets into the political background of it, and kind of like some of the history of oncology and some of the limitations oncologists have. And so it's great perspective, just like you talk about with Dr. Means, looking back at the Flexner report. All of this, it's out there now. It's very valuable information to go back and search that, yes, we can go well beyond the pills and surgeries right now, and find this integrative approach and pull back in a lot of things that have been missing in Western medicine. Ozone, for example, has been around for, long time. It's 3 oxygen molecules. Guess what they've been using over in Europe for many years? They haven't had, the countries are not as able to provide all the pharmaceutical support, so they look through modalities to help manage their patients' care. And that includes hyperbarics, that includes ozone therapy. There's a rich tradition in Europe in ozone, and in Italy, and a lot of doctor shops have this over there. So again, I think it's like we're expanding the horizon here, and that's that silver lining. And you're starting to see more and more mainstream doctors that were trained traditionally, like myself, bring light to these areas. So it's a hope-filled time again, and because we're going to continue to learn new things, apply new things, pull things up that maybe have been around that we have not been applied to folks' medical journey and care, and we're gonna see levels that we haven't seen before.
I agree. I think the medical community is set to blast off. I really, as you like to say, you like to have another option for a tool in the toolbox. I think the tools.
Totally.
I think the tools are there. They're coming out. People are accepting them. That there's traditional ways of doing things. There's non-traditional ways of doing things. Maybe a combination of both. But I think there's.
It's choice, Dave.
Yeah.
It's choice. I mean, don't you want more choices when you're going to the store? I mean, more choices are a good thing.
Yeah,
so.
Absolutely. Listen, we do have much to be grateful for. I wish you and your family a very blessed Thanksgiving. Thanks for being with us every Wednesday and sharing with us your unique perspective with dealing with patients on a daily basis and sharing those success stories. It's really cool that people are not only surviving, but they're going and getting the most out of every day. That's super cool stuff. Thank you for that. Have a great Thanksgiving, Dr. Meyer.
Yeah, thanks for the opportunity to share the good news, and to the best KILR. You all do a fantastic job, and happy Thanksgiving to everybody.
Thank you very much. Dr. Bradley Meyer at Okoboji Wellness Clinic. And if you want to start a new journey on your health care, go to OkobojiWellnessClinic.com. Give them a call. They'll do a discovery call with you. Won't cost you a thing. Talk about your health care and move on from there.